Mr. Srinivas, Deputy Director Administration, Mr. Panda, Additional Secretary, other officials from the Ministry, my colleague directors from various AIIMS, all the participants in East Asia Summit from India and from 13 countries. We welcome you all to this East Asia Summit at the All India Institute of Medical Sciences. At the very first outset, I would like to express what our Union Health Minister has conveyed. He has expressed and sends his greetings for this summit, for successful outcome of this summit. Due to sudden preoccupation this morning, he is unable to join us in this function, which he had promised to do that, but he is conveying his greetings through the Union Health Secretary and myself. On behalf of the All India Institute of Medical Sciences, I extend warm and hearty welcome to each and every one of you. Delegations who have travelled from Myanmar, Thailand, Indonesia, Singapore, Australia and Cambodia, USA, New Zealand, the directors, as I mentioned, from our sister institutions, from Rishikesh, Raipur and Jipmar, nursing personnel, for the first East Asia Summit Roundtable on Trauma and Nursing, which is being hosted by the Ministry of Health and All India Institute of Medical Sciences in New Delhi. On a personal note, it is a memorable occasion for me, as AIIMS has commenced its Diamond Jubilee celebration on 25th of September 2015. And we'll have year-long programs lined up during this year. The All India Institute of Medical Sciences was established in 1956, and it is a proud moment for all of us. This roundtable is being hosted by India in pursuance of a commitment made by our Prime Minister at the 8th East Asia Summit held on October 10, 2013 in Brunei Darussalam. We have tried to design the conference schedules to provide delegates to understand the status of development of trauma care in East Asia region. There will be 6 technical sessions following the inaugural session, with each session focusing on specific issues of importance in the field of trauma and nursing. Country presentations have been incorporated in the sessions. Session 1 to enable exchange of information amongst members on the status of development of trauma care. The session on pertinent issues in road traffic injuries and trauma care will provide an overview of the trauma care systems prevailing in each country. We'll be discussing the tertiary care health facility and the capacity building initiative that are envisaged from trauma care through regional cooperation. Trauma nursing is an important subject. Nursing in general is a very important subject, but when it comes to trauma, it becomes even more. This will be discussed in session 6. India is in transition from a largely agriculture-based country to an industry and technology-focused economy, and with our Prime Minister giving thrust to Make in India, it is likely to happen rapidly. Now, if we look at the magnitude which India is facing or other countries are facing today, the trauma is the leading cause of death and disability, as mentioned by Dr. Sushma. And I generally ask whenever I am talking about trauma that the tsunami hit India in 2004-05. The Himalayan tsunami we saw in June of 2013 in Uttarakhand. We saw disaster in Kashmir, flash floods last year, in Leh, in other parts of the country, many natural and man-made disasters. And it is a very favorite question I ask from the participants who come for trauma training: how many people lose their lives on our roads? Practically people have no idea. I said nobody is talking about road tsunami which hits every nation including India, and India has a dubious distinction of surpassing China possibly, because the figures from China are less than what the people are killed on Indian roads. And precisely in 2014, for which figures are out already by National Crime Record Bureau, we lost 141,000 young lives on our roads. Total 425,000 accidental deaths. And when I say this is only the tip of the iceberg. The deaths are only the tip of the iceberg. The disability, many of them they die following injury in hospital, while taking to the hospital, in the emergency departments, in the wards, ICUs, etc. And those who are injured, they are 50 to 60 times. Severe injuries are 10 to 12 times of those killed. Minor injuries, so-called minor injuries. And my dean academic would vouch with me that he had a minor trauma. He can tell you for how long he was off work. My dean research, you can ask, he had a severe injury. So it's something which we need to focus on. And if we look at the global scenario, Southeast Asia and East Asia, developed country fortunately have put in strict rules, regulations, traffic rules which are being followed. There is regulations, but in India that is not happening. In other developing countries it is not happening. Another distinction which we have, 72% of our motorized automobiles on our roads are two-wheelers. They are not four-wheelers as Western countries. But Western countries have brought down injury morbidity to a large extent by putting in place injury prevention strategies. Whether we like it or not, if we look at Indian perspective, we lose 3% of our GDP in trauma care. It has become one of the commonest reasons for indebtedness in India, both in urban and rural India. Road traffic injuries constitute about 40% of all accidental deaths and injuries. The important reasons for increased mortality in developing countries like ours are non-availability of trauma systems, which developed country has put in place to a large extent. And I am glad to share, recently we visited Melbourne because we have a bilateral project ongoing, and the Australia actually has put 2025 as a zero tolerance for accidents and accidental deaths. I think that is very, very significant. We are far from there. Provision of essential emergency trauma care universally would require robust pre-hospital care, in-hospital, very efficient in-hospital care, for which we need infrastructure. We'll talk about that during today and tomorrow. Trained manpower, both medical and paramedical, available 24/7, manning all these facilities, which we'll be talking about. And that is something which needs to be done with some urgency. We also need to have a emergency medical services legislation which is not there in most states of India. We also lack good data related to trauma research. We are doing that. We have a hospital-based registry at Trauma Center, but we want to make a network amongst all the sister institutions. Then, when we talk of trauma care, it is resuscitation to rehabilitation. Practically in the civilian sector, I don't know other countries in East Asia, but at least in India, the rehabilitation facilities are very scarce. They are small. They don't respond to patients' need to the extent we want them to respond. And we were happy to include rehabilitation as a core in the 12th five-year plan. Injury prevention is the key. And I say this, that if I develop a cancer, I may not have any control on that. If I have heart disease, I may say, okay, I will not get it treated. let me die whenever I die. But injury is something where you cannot avoid going to a hospital. You have to. If you break your bone, if you injure your head, if you injure your liver, you have to go to a hospital for treatment. And that is where injury is different than other diseases. And it is disease of the young. The establishment of Apex Trauma Center along with AIIMS came up in 2006 after a long recourse for this establishment, and I am happy that now we have at least a center which can be a role model for other upcoming trauma care facilities around the country and also in East Asia and other parts of the globe. We have initiated certain efforts towards manpower development by introducing trauma life support courses for doctors, nurses, paramedics, for lay public, and also long-term training for people coming from army, paramilitary forces, other medical colleges, other hospitals. We have also taken initiative. We are very conscious of that trauma education is essential both at MBBS level, at postgraduate level, and after that in nursing as well as in medicine. So what we have done, we have initiated the departments of emergency medicine. We have also initiated MCH in trauma surgery, which will be admitting first batch from 2016, and also fellowships in various trauma subspecialties and critical care as well. The Government of India has recognized injury as an important health and developmental issue, public health issue, and has intensified support, for which I am sure our Secretary will tell us more, for both prevention and system-wide response. National safety promotion and injury prevention requires an integrated and coordinated approach by all stakeholders. It is not only one institution or one agency or government can do, it is the involvement of everyone would require that. It's a huge task. This East Asia Roundtable has given us an opportunity to move forward in regional cooperation in the field of trauma care and nursing, which is a major problem not only in this region. If you look at globally today, there is a huge deficiency of trained medical and paramedical human resource. I do once again extend a warm and hearty welcome to all those from India and overseas present here, and consider that it's an important summit and we'll have very useful and fruitful deliberation and will come out with an outcome document. I again welcome you all, ladies and gentlemen. Jai Hind. Thank you.
Thank you very much, sir, for igniting our chords against this road tsunami. A very nicely coined term, and which can bring us all to write up or to think about how to control this tsunami. And now I request Mrs. Pooja Kapoor. She is a Joint Secretary in the Ministry of External Affairs and also looks after the ASEAN nations. Welcome, ma'am.
Good morning. Shri Bhanu Pratap Sharma, Secretary, Health and Family Welfare, Government of India. Professor Dr. M.C. Mishra, Director, All India Institute of Medical Sciences. Shri Arun Panda, Additional Secretary, Health and Family Welfare, Government of India. Shri V. Srinivas, Deputy Director, AIIMS, All India Institute of Medical Sciences. Distinguished delegates from East Asia Summit participating countries, eminent speakers from India and abroad, distinguished doctors and nursing personnel from AIIMS and its sister institutions, ladies and gentlemen. On behalf of the Ministry of External Affairs, I would like to extend a very warm welcome to all of you, and in particular to the delegates who have travelled all the way from their respective countries to participate in this EAS Roundtable on trauma care and nursing. I would like to compliment and thank the All India Institute of Medical Sciences and the Ministry of Health and Family Welfare for their unstinting efforts in organizing this roundtable meticulously and to a high standard. For those of you who may not be familiar with the East Asia Summit, it is the preeminent grouping of heads of state and government in the Asia-Pacific region. It includes all major countries of the Asia-Pacific, notably the United States, Russia, China, Japan, Republic of Korea, Australia, New Zealand and India, apart from the 10 ASEAN countries of Southeast Asia, which lie at its core. The East Asia Summit focuses on strategic political and economic issues of topical, global and regional importance. There are 6 designated priority areas of cooperation under the EAS Development Initiative. These are energy, education, finance, global health issues including pandemic diseases, environment and disaster mitigation, and finally connectivity. Global health and pandemics have been in great focus in recent years with the outbreak of Ebola, SARS, MERS, swine flu, and numerous other killer diseases, which spread fast across borders and regions, inflicting much damage in their wake. India is part of the Asia-Pacific Leaders Malaria Elimination Initiative, which aims to make the Asia-Pacific free of malaria by 2030. India also participates in international cooperation efforts to combat pandemics and has made a contribution of $12 million in the efforts against Ebola. India is a founding member of the East Asia Summit and actively participates in it at all levels, at the heads of government level, at ministerial level, senior official and technical levels, to constructively engage with countries of the region, especially at a time when our foreign policy has evolved from what we call the Look East policy to a more action-driven and result-oriented Act East policy. India considers the plan of action on the Phnom Penh Declaration on the EAS Development Initiative, which was adopted by the foreign ministers of EAS countries last year and has been extended up to 2017, to be an important guide to channelize our collective efforts for the greater good of the region. Under the EAS rubric, we have taken a lead on initiatives in the field of education, inter alia by re-establishing the ancient Nalanda University as a world-class university. In the field of disaster management, we have set up an EAS virtual knowledge portal, which is also located in New Delhi at the National Institute of Disaster Management. At the 8th East Asia Summit in 2013, India, along with other EAS participating countries, recognized health as a fundamental right of our peoples. The importance of achieving universal health coverage to address diverse health needs and improve the health outcomes of our peoples by exploring possible areas of cooperation, including addressing broader global health issues, was also acknowledged. It was on this occasion that our Prime Minister announced that India would be hosting a workshop on trauma care and nursing. Trauma can be both natural or man-made. Thank you. Today's roundtable on nursing care and trauma is extremely relevant as most EAS countries are disaster-prone and frequently suffer from cyclones, floods, landslides and earthquakes. We all remember the horrific scenes of destruction in the aftermath of Typhoon Haiyan or Hurricane Katrina. Moreover, road traffic and industrial accidents are on the rise. Road accidents occurring due to higher traffic densities and poor road conditions are the most common source of trauma from man-made causes. The vulnerability of trauma victims is accentuated by the poor socioeconomic conditions which prevail in some parts of our region. India itself, as Director AIIMS mentioned, is one of the most road accident-prone countries in the world, with accidents resulting in loss of life, livelihood, infrastructure, and public utilities. Trauma majorly affects the young and productive population, which is otherwise healthy and free from chronic diseases, making it even more important to deal with this area efficiently and effectively. Our External Affairs Minister, Mrs. Sushma Swaraj, in her message addressed to all of you, has expressed the hope that this roundtable will address the need to develop a robust trauma care and nursing system aimed at creating integrated trauma care management, including imparting of immediate medical response, providing of intensive hospital care, and facilitation of long-term rehabilitation. It will hopefully also contribute towards achieving an integrated multilateral approach for knowledge sharing and technology transfer in the field of trauma care and nursing. The outcome documents that our host and knowledge partners, AIIMS, have prepared is both comprehensive and ambitious. It proposes setting up of an EAS web portal on trauma care and nursing, creation of an EAS trauma center, establishment of a highly specialized trauma care unit in fact, various areas and zones which are prone to national disasters, as well as which have high density population clusters, and finally working collectively for capacity building to provide quality trauma care and training programs for nurses, doctors, paramedics, and first responders. These steps are both practical and useful, and we hope that you will help give shape to them and take them forward on your return home. On behalf of our External Affairs Minister and our Permanent Secretary, I would like to wish all participants a fruitful and productive roundtable. I also hope that you will be able to find some time to experience the multitude of exciting things that Delhi has to offer. Thank you for your attention.
Thank you very much, ma'am, and thanks for highlighting the objectives of this summit. Now I request our honorable guest, Shri Bhanu Pratap Sharma ji, Secretary Health in the Ministry of Health and Family Welfare, to kindly come and address the audience. Thank you,
sir. Dr. MC Mishra, Dr. AIIMS, Ms. Pooja Kapoor, Joint Secretary, Ministry of External Affairs, directors of various top institutions of the country, esteemed faculty of All India Institute of Medical Science and other medical institutions in the country, my colleagues in the Ministry of Health and Family Welfare, esteemed delegates from the EAS participating countries, ladies and gentlemen. At the outset, let me extend a very hearty welcome on behalf of the Ministry of Health and Family Welfare for coming to India. I hope that you will have very pleasant stay in Delhi, and the deliberations in this roundtable will be extremely fruitful. The topic, of course, is very, very important, as Dr. Mishra pointed out at the outset. India has a huge number of deaths and injuries, and we are doing a lot, but we have some distance to cover if we have to, ensure that so many deaths do not take place. I'm also happy to say that this conference is being held in pursuance of commitment made by the then Prime Minister of India on October 10, 2013 in Brunei Darussalam, wherein he proposed an initiative for cooperation in this regard. The EAS region is extremely important. This is a region which is coming up, and with a large population and a lot of disasters and road traffic accidents in this region. I think this is an extremely appropriate initiative to be taken. There have been a lot of international effort. WHO in 2004 recognized road safety as one of the major killers, and that year the slogan was "Road safety is no accident," and which highlighted the importance of the road safety. We are currently celebrating UN Decade of Action for Road Safety 2011-2020. So it's a very appropriate time to have this roundtable. I would like to concentrate on what we are doing in this country. Dr. Mishra has already pointed out some of the efforts. The first point, of course, is the establishment of this APEX institution in the All India Institute of Medical Science. This is the APEX institution for quality trauma patient care facilities in India, with the mandate to act as a role model to other trauma centers of the country. Not only does it provide the patient care facilities, The role of this Apex Trauma Center is envisaged as an Apex research and training institution which helps the nation's administrator to formulate policies regarding optimization, organization of trauma care facilities throughout the country. This has a large facility, 190 beds, 37 ICU beds, 6 OTs, 35 bedded ED and triage. The Apex Trauma Center is being further expanded to have 260 beds with added 16 ICU beds, 3 OTs, 30 bedded ED and triage, addition of private wards and patient attendant hostel with helipad, and that work is progressing very swiftly. Apart from that, we are setting up a large number of AIIMS-like institutions. 6 have already started functioning, and 11 of them are coming up. Some have been sanctioned, some are in the process of being sanctioned, and all of them have trauma care facilities on the same pattern as All India Institute of Medical Science, New Delhi. They are spread all across the country, and all of them should come up. Apart from the 6 which have already come up, the others should come up in 5 years' time. So we'll have a huge network of All India Institute of Medical Science. Virtually every state will have AIIMS-like institution. Apart from that, we are upgrading the existing medical colleges. About 70 medical colleges are being upgraded, where trauma care is a very important component. Some are exclusively for trauma. I am told 12 of them. 12 of them are only on trauma, but all the medical colleges which are being upgraded, they also have this trauma facility. Apart from that, we have a scheme which is currently under progress and is to be completed in this 5-year plan period, where we are setting up 225 trauma care centers of different level, trauma care level 1, level 2, level 3, and level 4 of course is ambulance, which is being implemented by the Ministry of Road Transport. The level 3 is at the district level hospital or a block level hospital with about 100 to 200 beds, whereas the tier 2 is a hospital with about 300 to 500 bed, and level 1 is a large tertiary care hospital. The objective is that all the highways, they will have this string of trauma care centers, and no patient will have to travel more than 50 kilometers to reach a trauma care center. The distance between 2 trauma care centers is not more than 100 kilometers. That scheme is being implemented. Some of the trauma care hospitals have already come up, and we hope that in 3 to 4 years, these trauma care facilities will come up in the entire country. Apart from that, we have issued guidelines to all the clinical establishments across the country that if there is a trauma care patient and if they are brought in an injured condition, then they should not refuse the patient, and whatever resources they have, using that, they should try to stabilize the patient, and after that he should be sent to the higher level of institution. They cannot refuse just saying that we do not have advanced trauma care facilities. They have to stabilize the patient. This instruction has been issued early this year. For the protection of good Samaritans, also we have issued guidelines, because many a times they are harassed by different authorities, and people are very scared to bring them to a trauma care facility. So we hope that these guidelines will make a difference, and the trauma care patients will not be left unattended on the road. Of course, the problem in setting up such a large network is the shortage of manpower. You need anesthetists, you need orthopedic surgeons, you need neurosurgeons, We are really short of particularly neurosurgeons. We just have about 1,500 neurosurgeons in this country of a billion population. We are trying to increase the seats for all these specialities. The current norms are under consideration, and we hope that once the norms are revised, we'll have more seats in our medical colleges, and we'll have more neurosurgeons and orthopedic surgeons coming out. In nursing also, we have a course for trauma care. MSc Trauma Care has been started. There are not too many takers for this course. So what we are thinking that perhaps the constraint is the number of sanctioned posts in the government. So unless those posts are sanctioned, they have some sort of employment, assured employment kind of a thing. People are not willing for such courses. So the posts need to be sanctioned. We are taking it up with the state government and our trauma care facilities where we can have the nurses with advanced training in trauma care. Apart from that, the nursing practitioner course is also under consideration. And once the nursing practitioner concept is there, then the nurses would be able to provide trauma care. The nursing practitioner would be able to provide the trauma care at the various facilities across the country. We have ambulance network. 108 is the number where the trauma care patients, or in fact any emergency patient, can avail of that facility, and the government supports the cost also, particularly for in case of pregnancies, etc. The cost is borne by the government under our national health mission. We have many mobile medical units which could also be used for trauma care support. As I mentioned, that we are doing a lot, but we also need to do a lot more. As Dr. Mishra mentioned in his opening speech, the prevention, of course, holds the key. We can provide trauma care, but we must try to prevent the road traffic injuries, and that aspect also has been looked into. The road design. The first thing, of course, is the road design. The road design itself must have the inbuilt safety features, and the personal safety. This is something which has to be done through IEC, and the safety measures in the vehicles, etc., have to be inbuilt. All these things are being looked into. There's a constant IEC to develop that. The outcome document about that, Joint Secretary MEA has already mentioned. We hope that there will be discussion on that, and we'll be able to come out with an agreed version which will take care of our need. So I would wish all the delegates again a very, very pleasant stay in Delhi, and I would also hope that the deliberations will be extremely fruitful. I thank All India Institute of Medical Science for organizing this very, very important roundtable. Thank you very much.
Thank you very much, sir, for enlightening us with the Ministry's efforts on this issue. And now I request our Director, Professor Mishra, to felicitate our Chief Guest with a plaque. This is an Institute plaque engraved All India Institute of Medical Sciences. So please felicitate Mrs. Mona Kapoor, Joint Secretary from the Ministry of... I also request to felicitate Dr. Arun Panda, Additional Secretary in the Ministry of Health. Thank you very much, sir. Now I request our Deputy Director Administration, Shri V. Srinivasji, to kindly come and give vote of the thanks.
On behalf of the All India Institute of Medical Sciences, I wish to thank the Ministry of Health and Family Welfare and the Ministry of External Affairs for providing the Institute the opportunity to host this important roundtable on trauma care and nursing. The event represents an important milestone in India's commitment to ongoing multilateral efforts under the EAS umbrella. It also adds considerable value and momentum to the ongoing research, patient care and education work on trauma care being undertaken at the JPN Apex Trauma Care Center in the Institute. I wish to thank all delegates who have travelled from Thailand, Indonesia, Singapore, Myanmar, Australia, Japan, United States, Korea, New Zealand and Cambodia to participate at this roundtable. We will greatly benefit from knowing about the work being undertaken in your countries on trauma care. I would also like to thank all the speakers who have travelled from across the country to present their work at this roundtable. I take this opportunity to thank Shri B.P. Sharma ji, Union Health Secretary, Shri Arun Panda ji, Additional Secretary in the Ministry of Health, Shri Sunil Sharma, Joint Secretary in the Ministry of Health, and Shri Sudeep Srivastava, Director in the Ministry, for providing us with the policy level guidance and requisite government support in this endeavour to ensure that the Indian commitments made at the 8th EAS Summit stand fulfilled before the next summit meeting. I must place on record my appreciation for the support and encouragement received from Srimati Pooja Kapoor, Joint Secretary in the Ministry of External Affairs, who reiterated and reinforced my understanding that the EAS represents the preeminent multilateral group based on India's core principles of democracy and economic liberalism. The outcome document circulated by the Indian chair represents these shared multilateral collaborative values. The EAS Roundtable represents the largest multilateral conference hosted by AIIMS. We have worked tirelessly for the last 40 days to make this event possible. On this occasion, I would like to thank my distinguished colleagues in the Institute, Professor M.C. Mishra ji, Professor O.P. Kharbanda, Professor Manish Singhal, Dr. Amit Gupta, Dr. Sushma Sagar, Dr. Kalpana Luthra, Shri Arun Kumar Singh and Shri Pallav for all their support over the past 40 days to present the technical work being undertaken in the country to this global audience. I would also like to thank Srimati Helen Acharya, Secretary Sangeet Natak Academy, for her support in arranging a spectacular cultural evening with an event that has been presented in more than 25 countries. Once again, wishing you a comfortable stay in Delhi and hope to achieve significant progress in this conference. Thank you.
I request Dr. Amit Gupta to make an important announcement. Dr. Amit Gupta is the scientific chair of this program.
Thank you, Dr. Sushma. Just a request to all the delegates, dignitaries present here and everybody in the hall, kindly accompany us to the convergence block for a group photograph, and after the group photograph we'll break for the tea and coffee. Right. Thank you.